Now we shall discuss about the layers of the abdominal wall. Okay, so layers of the anterior abdominal wall. Layers of the anterior abdominal wall. So let us see what are these layers of anterior abdominal wall. If you look at the layers from top to bottom, the outermost layer will definitely be, for example, if I am making an incision, the outermost layer will be definitely skin, right? So the outermost layer is always the skin. Okay. Now after the skin, you have got the subcutaneous tissue, fat and all, and after that you have got fascia. What fascia is that? Superficial fascia. Okay. The next fascia is superficial fascia. But here in the anterior abdominal wall, the superficial fascia is comprised of two things. Okay. So there is a fatty layer, there is a membranous layer. Fatty layer is outside, membranous layer is inside. Okay. So there is an outer fatty layer, and that fatty layer outside is called as camper fascia. Outer fatty layer is called as camper fascia, right? And next, inner, what do we have? Membranous layer we have. Inner membranous, outer fatty, inner membranous layer we have got. So this membranous layer is called as Scarpa's fascia. This is called as Scarpa's fascia. So we have got two layers. Outer fatty layer is called as Camphor's fascia and inner membranous layer is called as Scarpa's fascia. Okay. Now after the superficial fascia, you don't have deep fascia here. In the anterior abdominal wall, the deep fascia is absent. Okay. So directly after the deep fascia, what do we have? Muscles, right? So there is no deep fascia. So directly now we have to write muscles. So what are the muscles that are located? First important muscle is external oblique muscle, right? After external oblique muscle, next what do you have? You have got internal oblique muscle, right? After internal oblique muscle, what do you have? Transverse muscle, that is transverse abdominis. Transverse abdominis muscle you have got. And after transverse abdominis, what do you have got? Transversalis fascia. Okay, after transverse abdominis, you have got transversalis fascia. Transversalis fascia. After the transversalis fascia, what do you have? You have got the next important thing, that is a tissue which is also called as extraperitoneal tissue. Extraperitoneal tissue. And after the extraperitoneal tissue, you have got peritoneum, right? What are the two types of peritoneum you have got? You have got parietal peritoneum, you have got visceral peritoneum. So here we have got the parietal peritoneum. Parietal peritoneum. So if you look here, these are the layers which are located one by one. Okay, one beneath the other. So these are all the layers which are located. So skin, superficial fascia, and after that you have got these three muscles over here, right? External oblique, internal oblique, and transverse abdominis. Then you have got transversalis fascia, extraperitoneal tissue, and parietal peritoneum. So these are the structures which are located from outside to inside. Okay. Now, why is deep fascia absent in the anterior abdominal wall? The reason is that whenever you are eating food, right? So if there is deep fascia, this deep fascia will not allow the abdomen to stretch forward, right? It will not cause any kind of stretching of the abdomen. So when you are eating food, obviously your abdominal wall stretches out. Yes or no? So if there is deep fascia, this will not allow the abdominal wall to stretch out. Okay, put the meals aside. The next important thing is that during pregnancy, we need that the lower part of the abdomen to be stretched out, right? So this deep fascia, if it was there, then this will prevent the stretching of the lower abdominal wall in case of pregnancy. So absence of deep fascia will allow the distension of the abdominal wall mainly during the pregnancy. So that is the reason why we don't have a deep fascia here. Okay, right. Next important thing is that these are the layers here. Very important clinical point I want to tell you is that all of you know there are two important structures. Let us say one is umbilicus. Okay, one is umbilicus. Okay, and let us also tell that this is the right inguinal, this is the left inguinal. Okay, and you know we have got a projection like this from the cecum here. What is this? This is called appendix, right? You know, appendix is supplied by a nerve that is coming from T10. Okay, so appendix is supplied by T10 spinal segment. So how is appendix supplied? T10 spinal segment. Okay, so the same T10 spinal segment also supplies your umbilicus. So even umbilicus is also supplied by T10 spinal segment. That is the reason why whenever you have any kind of infection of the appendix, you call it as appendicitis. So whenever a patient is having appendicitis, what will happen? The pain is periumbilical. Why the pain is periumbilical? Because the same nerve is supplied to the umbilical region also. So that is the reason why in a patient with appendicitis, there is a referred pain around the umbilicus. We call it as a referred pain around the umbilicus. So why? Because both of them are innervated by T10 spinal segment. Okay. Now, before discussing another important topic, you have to know one very important thing regarding the embryological derivatives. Okay. There are 4 important embryological derivatives at the level of umbilicus. What are these 4 important embryological derivatives? Now, all of you look here. Let us say this is the urinary bladder. Okay. And this is the urethra. So during the embryological time, connecting the urinary bladder outside to the umbilicus, there is a structure called as urachus. Okay. Later on, the urachus gets obliterated. Okay. Obliterated matlab disappear ho jayega urachus. Okay. See, important thing is that just above the urinary bladder. Okay. First of all, let me draw the umbilicus. Let us say this is the umbilicus. Okay. So below the umbilicus, there is a structure that is attached to the urinary bladder. Okay. This structure is in the center. So any structure is in the center, I should call it as median, not medial, it is median. Okay. So this is median umbilical ligament. Umbilical ligament. What is this median umbilical ligament? Medial umbilical ligament, previously it was a urachus. Okay, this was a connection between the umbilicus and to the urinary bladder. So that urachus obliterated and now it transformed into median umbilical ligament. Okay, so median umbilical ligament is a remnant of urachus, okay. On either side of the umbilicus, you have got 2 ligaments that are hanging down like this. Now these 2 ligaments are called as medial umbilical ligaments. Now this time it is called as medial. This is medial, this is median. Okay, medial umbilical ligament. These are called as medial umbilical ligaments. Now what are these medial umbilical ligaments? Medial umbilical ligaments are the remnant of umbilical artery. Remnant matlab the remaining part of umbilical artery. So medial umbilical ligaments are the remnant of umbilical artery. Okay, so they are the remnants of the umbilical artery. Now after that, just above this, we have got another structure that is coming all the way above the umbilicus and attached to the umbilicus. Now this is called as ligamentum teres. Now this one is called as ligamentum teres. Now what is ligamental teres? Remnant of umbilical artery is medial umbilical ligament. Now the remnant of umbilical vein. Okay, so this is the remnant of umbilical vein. So remnant of umbilical vein is called as ligamentum teres. So how many remnants are there? How many embryological remnants of umbilicus are there here? 4. Right. So the first one we discussed is the remnant of urachus, that is called as median umbilical ligament. Very very important guys. Each one can be an MCQ here. Remnant of urachus is your medial umbilical ligament. Remnant of umbilical artery is your medial umbilical ligament. And the remnant of umbilical vein is your ligamentum teres. Okay, so these are what? These are the 4 embryological remnants of umbilicus. These are the 4 embryological remnants of the umbilicus. Okay, right. Let us look at the pathologies one by one. Okay, the first pathology is that, see, for example, if you look at the fetus over here, this is called as a head fold. Okay, and this is all the way down going like this. Now these are called as the arches, this is called as a pericardial sac, and here is the gut region. Right. Now in this developing fetus, if you see, here you have got a foregut, right, and here you have got a hindgut. Connecting the foregut as well as the hindgut, whatever structure you have got, this is called as a midgut. Now this midgut over here, right, this midgut has got a duct like this, right, and where is this duct attached? This duct is attached to the yolk sac. This is the yolk sac, and this duct in between is called as vitello-intestinal duct. Okay, what is the name of this duct? This is called as vitello-intestinal duct. So at one time what will happen is that this vitello-intestinal duct will undergo obliteration. Once when the yolk sac is finished, once when the food within the yolk sac is finished, what will happen is that this vitello-intestinal duct undergoes obliteration. It closes abruptly like this. For example, if there is no obliteration, if it is open, then what will happen? In the developing baby, from the anterior abdominal wall, whatever feces that are present in the gut, don't you think this feces will be excreted outside through the umbilicus here? Right? So when the feces will be excreted outside, this kind of fistula you call it as fecal fistula. Okay? This kind of fistula is called as fecal fistula. Just look at the picture here. So this is the fecal fistula which you can see. Okay, so this is the fecal fistula here. And next important thing is that, let us say you are looking a person from the side, right? So if he is looking like this and you are looking from the lateral aspect. So when you are looking from the lateral aspect, let us say that this is the anterior abdominal wall. This is the skin of the anterior abdominal wall, right? Now just behind this you have got a muscle like this, right? What is the name of this muscle? This is called as rectus abdominis. Let us say this muscle which is present here, this is called as the rectus abdominis. Okay, and next important thing here is that you need to know that this, during the embryological time, what was happening, I will tell you. During embryological time, this is how it is infolding inside like this, right, infolding inside, and this is forming a bladder here. Right, now this bladder over here is called as urinary bladder. Now within this urinary bladder, here you see this is the umbilicus, right? So umbilicus is continuing as urachus, and finally you have got this bladder over here, right? So what is this structure over here? This is called as urinary bladder. Okay, and what is this opening over here? This is called as urachus. Okay, urachus. Where is urachus opening? Urachus is opening into the umbilical region here, into the anterior abdominal wall. Okay, now can I tell that the urinary bladder is in continuation with the urachus during the embryological time? Yes. Now what will happen is that this urachus, right, this urachus, the remnant of urachus or this urachus will obliterate and form median umbilical ligament. For example, if the urachus fail to obliterate, for example, if this fails to obliterate, if it fails to obliterate, what will happen, guys? What will happen is that whatever urine is in the urinary bladder, the urine starts flowing out, right? The urine starts flowing out, and this condition you call it as what fistula this time? Urinary fistula. This kind of fistula you call it as urinary fistula, right? So I don't have a picture of urinary fistula, but this is how the urinary fistula looks, right? Next important thing. So what will happen, for example, whenever there is, within the urethra, the membranous part of the urethra is the weakest part, because there only urethra is there. Surrounding the urethra there is nothing there. So that is the weakest part of the urethra. What will happen if the urethra ruptures? Where will the urine go? Okay, so we shall look at that. Now this is a very important topic, just pay attention here now. So let me draw a picture over here. right? So this is the person which you are looking from the lateral aspect. Okay, so in the lateral aspect, if you see here let us say you have got your anterior abdominal muscles, right? Let us say this is your rectus abdominis, and where is rectus abdominis attached? Rectus abdominis is attached to the pubic symphysis. Let us say this is the pubic bone. Okay, and after that, here you have got a structure like this. This structure is called as urogenital diaphragm. So just above this over here, we have got a triangular shaped part organ. This is called as your urinary bladder. So this is the urinary bladder here. Okay, now this is the urinary bladder that is flowing the urine all the way like this. And what is this? This part is called as your urethra. Okay, urinary bladder as well as the urethra. Now all of you look here. This is the penis. This is the penis all the way, right? And where is this urogenital diaphragm? This urogenital diaphragm is passing all the way behind the urethra till here. Clear? Right. Now here this yellow color shaded portion, whatever is there, this is the tissue of the penis, right? This is the penis tissue. Now after that, just beneath here, if you see below this, here you have got this scrotal sac all the way. This is a scrotal sac or the scrotum, right? Now let us look at what are the structures that are located. Now one thing to identify here is that you see this part of the urethra is a very weakest part, which is also called as a membranous part of the urethra, right? Now what did I tell you? I told you that after skin we have got superficial fascia in the anterior abdominal wall. This superficial fascia is having two parts, outer camphor fascia, which is right, outer camphor and inner Scarpa's fascia. Camphor fascia is a fatty layer and Scarpa's fascia is a membranous. So when I tell fatty layer, right, I should draw fat all over. See, this is a fatty layer which is also called as camphor fascia. So this is the camphor fascia which I am drawing right now. This is the camphor fascia. So this is the camphor fascia, and just beneath that we have got Scarpa's fascia. Scarpa's fascia is membranous. See, this is a membranous fascia which I am drawing down. This is your Scarpa's fascia. Okay, so this is your Scarpa's fascia all over. And remember one thing, the Scarpa's fascia, after entering into the scrotum, Scarpa's fascia continues as Colles fascia. Okay, so now this part over the fascia is called as your Colles fascia, and this fascia attaches to what? This fascia is attaching to urogenital diaphragm. So let us label the parts one by one, guys. Okay, so let us label the parts here. So this yellow color part is your camphor fascia. Camphor fascia. And remember one thing, that this camphor fascia, once it enters into your scrotal region, this camphor fascia is converted into dartus muscle. Okay, this camphor fascia is converted into a dartus muscle. Okay, next important thing is that this blue color lines, whatever are there, this is called as Scarpa's fascia. Scarpa's fascia. Okay. Next, what is this green color thing over here? This is called as urogenital diaphragm. Urogenital diaphragm. Urogenital diaphragm. Okay. And this is your scrotum. Obviously, this is your scrotum. And this is your urinary bladder. Now, listen carefully here. For example, if there is a break at this region, okay. For example, if there is a break of the urethra at this region, then what will happen if there is a break at this region? What will happen is that all the urine which is located in the urinary bladder, it will flow inside, right? So this place where it is flowing right now, this place is called as the perineum. Okay, so this place is called as the perineum. So this place where it is flowing right now is called as the superficial perineal pouch. Okay. So this one, these dots which I am putting now, this is the superficial perineal pouch. Now from here, can this urine go back into the ischiorectal fossa? The back side is the ischiorectal fossa. Can it enter back into the ischiorectal fossa? It cannot enter. Why? Because there is Colles fascia there. And second important thing is that this urine has only one possibility to go. Either it can enter into the scrotal sac, right? So once the urine enters into the scrotal sac, what will happen? There will be swelling of scrotum. Once the urine is in the perineal pouch, superficial perineal pouch, what will happen? There is swelling of perineum. And not only that, the urine even enters into the penis and it will cause swelling of penis. You see, it is entering into the penis and it will cause swelling of penis. And not only that, the urine even enters into the anterior abdominal wall also till here. Wherever the pubic symphysis is there, so this level of abdominal wall is the lower abdominal wall, right? So it even enters here and it will even also cause swelling of the lower abdominal wall. So whenever you see these swellings, then immediately you need to think that the patient might be having what? He might be having rupture of the urethra, right? And by the way, this fascia over here, whatever I've told you, this is your 𝐤𝐫𝐢𝐴 fascia, right? This is your 𝐤𝐫𝐢𝐴 fascia. This fascia over here is called as your 𝐤𝐫𝐢𝐴 fascia. And you can see here, this is a ruptured urethra. This is a ruptured urethra. And this pouch over here is called as superficial peritoneal pouch. Superficial peritoneal pouch. Right. So how do you know that the patient is having a ruptured urethra? So ruptured urethra signs are ruptured. What are the signs of the ruptured urethra? If you see, the first important thing, will the perineum get swollen or no? Yes, there is swollen perineum, right? So along with the swollen perineum, will the scrotal sac, will the scrotum get swollen or no? Yes, there is swollen scrotum also. Okay. And third important thing is that there is also swollen penis. There is also swollen penis. And fourth important thing, there is swollen lower abdominal wall. There is swollen lower abdominal wall. So these are the structures which are swollen. Okay.